Hi, this is Tony with StuffSeniorsNeed.com, and I am coming to you today with a video regarding the Medicare Open Enrollment Period. And the unfortunate thing about it is that the Medicare Enrollment Period, it's one of the most confusing parts about Medicare. That's why I want to take you through it as simple as possible, a way just to demystify this so that you understand what your responsibilities are and what your decisions need to be, and how the cost of the programs can be impacted by those decisions. So first of all, let's talk about government-run Medicare, and that's Part A, which is your hospitalization coverage, and Part B, which covers your doctor's visits and your durable medical equipment. That would be either wheelchairs, walkers, something like that. Now, for most of us, we become eligible for Part B, and this is the actual definition, starting the first day of the month you turn 65. So to convert that into English, let's say you were born on March 17th, 1947, and you turned 65 on March 17th, 2012. Your open enrollment period, okay, would begin on March 1st, 2012. Okay, and you're going to get a card in the mail before this date, giving you the option to either opt out of Part B or to sign up. If you sign up or if you do nothing, you're going to start getting charged the Medicare Part B premium starting the month of your birthday. Okay? The only people who are going to need to sign up for both Parts A and B, though, those are people who are going to still be working at 65. Okay? If you are still working, you are not going to automatically receive Parts A and B. So just please be aware of that. Now, here is exactly how this works, okay? And you can see it from this chart below, which actually comes from the 2012 Medicare and You brochure. So I put it here because I thought it really explained it in a very simple manner. And what that means is the month you turn 65, the 3 months before that, and the 3 months after that, you have the opportunity to enroll in your program for Parts A and B. So you have a total of a 7-month window. In the example that I was using for the person in March 17th of 2012, when that would be the date they're turning 65, you go 3 months previous to that. So you would go February, you would go January, and you would go December 2011. Okay, that's when it would start, and your options would end not until April, May, and June of 2012. So you would want to either sign up early so that you can avoid delaying your coverage, okay, or if you wind up waiting until 4 months after the enrollment period, you're gonna get a delay in coverage. So be on the lookout for this. Now, here is the enrollment period and what happens if you sign up late. Okay, if you sign up the month you turn 65, that means your coverage doesn't start until the month later. So in the example I was using for March 17th of 2012, when you turn 65, if you sign up in March, your coverage doesn't start till April. Okay? And so on for those next 3 months. So just to be clear on that. Now, if you don't sign up, okay, you can sign up at a future date, but your coverage is going to be delayed, and you are going to have to pay a higher premium for Medicare Part B. So, again, it's something to be aware of. Right now, as I speak in 2012, it's $99.90 a month. That's what the premium is. You would wind up paying more than that, okay? Just to be aware. Now, let's talk about open enrollment for the other plans. And this would be either a Medicare supplement plan, this would be Medicare Part D, the prescription drug coverage, or the Medicare Advantage plan, okay, which is the private version of Medicare that you would get from a private insurance company as opposed to dealing with the government. You can switch only at a very specific time of the year, and you're going to see the airwaves flooded with commercials for Medicare programs. That's going to wind up happening. It's typically from mid-October through the first or second week in December. One of those two, where you will have the opportunity to make your Medicare changes. One thing to note, though, with these programs, there are some special exceptions to when you have the opportunity to shift outside the Medicare open enrollment period. And just one example would be for an Advantage plan. If you are switching from one Advantage plan to another plan, and that new plan you're going to is considered a 5-star plan by Medicare, you have the option to switch any time of the year. So there are exceptions to these rules, and you're going to need to either contact your insurance company or to contact Medicare in order to sift your way through them, because unfortunately these little exceptions are always changing. But I hope that this helped, at least in some respects, to demystify this for you. This is Tony with Stuff Seniors Need, and I will see you next time. Take care.